Hi, my name is TUITUBOU. I am 64 years old. I came into India from a small island in the Pacific called Fiji. I have had arthritic knees for over 10 years, but it had kind of gotten worse within the last 3 years. And by the time I flew over to India, I could hardly walk. Apart from that, I also had spinal issues, which I have had repairs done on in the year 2014 in a first world country. I wouldn't say the name. Where I was diagnosed with something called cauda equina. Now I'll focus on my knee first. When I came in, I was picked up from the airport by the welcoming team at Yatharth Super Speciality Hospital that was led by the international coordinator Muskan Sharma. I must commend her on her professionalism and the team that came in with her, which included a nurse. After traveling for over 16 hours, I was tired, depressed, and everything that goes with somebody who's been in immense pain for so many months. But they were very caring, and the trip over from the airport to the hospital took less than half an hour. And right from the onset, I was taken straight into the ward where everything was done for me, where my vitals were done that was supposed to have been done in the outpatients. Everything was done on my hospital bed on level 9 in the hospital. From day one until a month after I finished both my surgeries, I must commend the doctors, the owners of the hospital, the two specialists that actually took care of my issues, Dr. Shobhit and Dr. Prankul. I must commend that they are the best in their own fields. With Dr. Shobhit, I came in, couldn't even walk. I had had arthritic changes for over 5 years, and he took care of those. I was taken into theater within 4 days of my arrival, and I was able to stand up within 48 hours and was able to walk within the third day. I must commend him and the physiotherapists that were taking care of me during that time. Now with my back, Dr. Prankul, I do not know how to thank this man. I was virtually in agony, and by the time I came here, I couldn't, for over 9 years, I was not able to have a normal bowel movements. Urine was okay, but it was beginning to play up on me. I was actually told when I had my surgery 9 years prior to that this problem will recur later on in life. And later on in life is fast forward 9 years. Now, for 9 years, I've been having coffee enema to be able to move my bowels. But after my surgery, within 24 hours, I was able to get my sensation to passing urine very well. And for the first time in 9 years, after my 4th day, I was able to feel sensation to moving my bowels, and I've been moving my bowels since then. I would say that Dr. Prankul fared far and above neurologists of first world countries. I wouldn't hesitate to commend this man and Dr. Shobhit in their own fields to be able to write journals. I hope they will write journals and share it with the world, their wealth of knowledge and their experiences. I am a testament to both these gentlemen's expertise, and I came into the country almost paralyzed, and I'm flying out walking to the airport. And for that, I want to thank the owners of the hospital, especially Dr. Manju, for being there right from day one, welcoming me, and all throughout the 1 month, checking in periodically. And both Dr. Shobhit and Dr. Prankul for their expertise, their advice, for which I will be forever thankful to.
So my name is Dr. Shobhit Bhardwaj. I'm a senior consultant orthopedic surgeon and a joint replacement surgeon at Yatharth Super Speciality Hospital. We met UNAISI a month and a half ago, and she was in terrible pain because of her knees, because of her spine, She could hardly walk. We examined her knee, we took x-rays and all relevant investigations, and we decided that she needs a knee replacement. One thing I liked her about was she was willing to walk. She was desperate to walk, and that's the kind of motivation which I look for in a patient before taking up for surgery. If a person is motivated enough, he will do rehab, he will do physiotherapy with a gusto which one requires. This motivation is the primary factor for me to decide on a knee replacement, and she had it. Post knee replacement, everything went quite easily. It was a straightforward, simple case. But the results, I was surprised. Third, fourth day, she could walk with so much of enthusiasm. I should commend her for her tolerance and ability to just fight through pain and be brave in face of such kind of pain which she has been suffering from 8 or 9 years. So the joint replacement surgery is a simple, straightforward surgery. We take the diseased part out and we replace it with prosthetics. And we tend to balance the knee from front, from sides, from outside and from the back, so that all deformities, all disease and painful part, they go. Patient recovers fairly quickly if he or she is motivated. So I will commend UNAISI for this thing.